With this, we are moving towards the last session of the day, that is a panel discussion on role of hospitals in advancing healthcare development leaders talk. For this leaders talk, I would like to call on stage Dr. Atul Kapoor, CMD, Regency Hospitals Limited. We welcome you, sir. Can we have a huge round of applause for Dr. Atul Kapoor, CMD, Regency Hospitals Limited? Dr. Sanjeev Singh, Medical Director, Amrita Hospitals. Dr. Rakesh Kapoor, Medical Director, Medanta Hospital. And Dr. Raj Gopal, CEO, Chandan Hospital. Can we have a huge round of applause for this session? Now, I would like to call on stage Mr. Souvik Goswami, the co-founder and the chief editor of APAC News Network, to moderate this session.
Hi, am I audible? Hello, just check. Hi, welcome all of you to the leaders from the hospital chains of Uttar Pradesh. This is Shobhik, co-founder of APAC News Network. I welcome you for this session. Uh, we'll try to make this session interesting, and we won't be asking same question to all of you. Rather, we can have different questions so that we can have divergent views. So let me start with Dr. Atul Kapoor, who is the CMD Regency Hospital. Uh, Dr. Atul, if I may ask you that, since the name of the session is Role of the Hospitals in Advancing Healthcare Development, the leaders talk, we are sitting with the leaders of the hospital ecosystem. In terms of outcomes or patient care delivery, how do you think that technology or innovation can be a game changer? Or do you think that there's still a lot of way to go? Your thoughts on that, sir?
Good afternoon, everybody. Thank you for calling me here for this session. Well, technology is the future of healthcare. Without cutting-edge technology, we cannot go forward. Let us imagine a simple thing, Dr. Kapoor would know, that simple, let's say, a robot, a navigation system, mobile CT scans on the operation table. Then, all kinds of apps today, treatment is done by apps only. The future of medicine, let us say, and the future of business to hospitals will come from digital apps only, ultimately, I'm telling you. More than that, any lot of surgical intervention is possible only with technology, innovation, and putting good equipment. Telehealth, all these things which you heard just now are primarily based on technology. And as we go forward, more and more technology and advances will be required to deliver quality healthcare.
So I had a hidden agenda when you asked the question, because I knew that this answer will be obvious. But when we're talking about leveraging technology, there are challenges also. There's a challenge of mindset within the hospital ecosystem. It happens with the offices also. What, according to you, is the most important challenge which we should address when we talk about using more and more technology or innovation for the future? If you can just pinpoint one of the challenges, and we'll try to find answers
The
from this.
challenges are basically the people accepting the technology, and the people working in the organization should be, supporting the technology. There's a wide gap, always when being something new, anywhere. I mean, then the first resistance comes from the people who work inside. How can you do it? It's not possible. It takes so much time. All these things are there. But at the same time, I'm telling you that it's a game changer. And gradually, people are accepting it. The new people who are joining the companies are accepting better technology and they're better equipped. The people who work for the last 15, 20 years are not so equipped. But again, there has to be a fine balance, because somebody who's working in an organization for 20, 25 years is an asset, basically. So then, that is the only challenge I see. Then at times, even the doctors, they are wary of accepting it. Like, let's say, we said no now, like NABH says that everything should be digital and all OPD records should be maintained by the company, by everybody. It's a big challenge. Doctors don't do it half the time. Dr. Kapoor will also tell me. You have to, you have to write in capital letters. Something are not practical. Ultimately.
Yeah. So I'll just come to Dr. Dr. Sanjeev Singh also, medical director, Amrita Hospitals, taking cue from what Dr. Atul Kapoor has just said, that uh, challenges of mindset accepting, right? Did COVID, we all know, we all talk about that, how COVID has been a game changer in a positive way, that the kind of technological innovation we were supposed to leverage for next 10, 15 years, we leapfrog that in 6 months, 1 year, or maybe 1.5 years time. During that, we saw the use of telemedicine. People who are not using telemedicine for so many years, all of a sudden in those 1.5 and 2 years, telemedicine became the norm, and it saves so many lives. Do you think that in terms of hospital administration management, this newest technologies can also be of help, or we should have a digital thing, like physical interventions as well as digital intervention, or not only digital? Your thoughts on that?
Yeah, thanks for the opportunity and great to be here. I'll just take a cue from what Sir said. Other than the acceptance, cost is a big deterrent. And until unless there is a program Heal by India and Heal in India, and there's a lot of Make in India program which is happening now. India is making 1.5 MR. So what is right now 8 to 10 CR would reduce, and then the acceptance also would definitely increase. Other than what Sir mentioned about clinicians' engagement. So the adoption is definitely critical, but for management, like in our hospital, we have built a command center. Now, command center is a big room which has almost 84 TV sets, and everything under the sun is managed. So if you OT utilization, OT, if I have 100 rupees, my 30 rupees goes into operation theater because it's capital intensive. I need to utilize it well. So there is an OT scheduler which is in the, so we don't allow any of the surgeons to put that on the diary. It's all transparent. It's like a airport airline booking. But then utilization and turnaround time, because unfortunately lots of nursing staff still believes to clean the theater. That's cost to us. And turnaround time has to be managed, which is just 20 minutes, because if your pressures are okay and your changes are okay, that's what is a good practice. Similarly, ICU utilization, those beds are very costly beds, both for the patient and for us. So it needs to be managed well, and we also need to have an appropriate revenue per operating ICU bed other than the total bed. How does this happen? It's through appropriate utilization. So there are people who are manning in the command center other than the GPS system for the ambulances. Like our neonates transfer happens with the neonate app, which the driver and the attendant can manage. And our neonates come for a congenital heart disease, which could be 27-weeker, less than 1 gram, 1 kilogram, but then he is not hypothermic because he's managed through the command center and every instructions are given. Our OT utilizations are now all wearable devices. So how do we increase our footfall? Because we are managers and we need to increase business. All wearable devices can be connected to my hospital, and I can get into every house because I manage the saturation. I see there, it's all coming on the screen. It's all there in the as a ECG, as a heart, and if there are any triggers, I can warn them to come to any of the hospital. But then they get associated, they get registered with us, they get associated with us. So technology and management is taking a leaps. Like we've just adopted a chatbot system in OP. While the patient is waiting, he will in the chatbot write the history. So now history taken, and that gets linked to our HIS. So he need not again wait because the most costly person for us is a doctor. So he again need not write the history. So technology is available and it's very cheap. So huge management difference which we are seeing.
So taking clue from what Dr. Sanjeev has said, I'll come to Dr. Rakesh. Dr. Rakesh Kapoor, Medical Director, Medanta Hospital. What Dr. Sanjeev has said, that if I take a crux of what he has said, that technology has been a game changer when it comes to cost effectiveness also, when it comes to management of hospitals. Do you agree, or do you have some different views on that?
No, definitely, he's perfectly right what he's talking
You can have a
about.
different view.
Yeah, no, it can't be because he also comes from a corporate. And even if you have a corporate or you are working in a government hospital anywhere, cost is a major factor. Because like I was discussing with the Secretary Sahab, when I was director in PGI, say the budget was 850 crore rupees an year, in which 700 crore was going for salary, for electricity, for maintenance and others. Hardly 150 crore was left for the equipment, for the buildings, and all other things. So cost is a matter everywhere. Like sir was saying, probably 3,000 crore or something goes in salary in UP. So technology is definitely going to help. Now the important thing what we have to understand is what Dr. Kapoor said, that acceptance is the first thing. Because हम लोग अभी जैसे कहा जाता है कि if you have not improved yesterday, you will never improve. Today you cannot claim कि today we will improve. And mediocrity का आज के दिन में if you are a mediocre, then you are gone. There is no space for mediocrity. So सबसे पहले important thing is that everybody has to accept, like what he talked about, HRF system in PGI. There was a lot of resistance when it came in. In other hospitals, they were visiting from all over the India, our HRF system. But वहाँ पे उसको लागू करना बहुत मुश्किल होता था, because you understand all type of, you will say, mafias and whatever word you use for them, they were there and not trying to put that system in. अभी साहब अभी सेक्रेटरी साहब सरप्राइज हुए, ही सेड कि एचआरएफ सिस्टम जो पीजीआई का था उसमें एक्सपायरी ड्रग का लॉस कितना, आई सेड नॉट अ सिंगल पैसा लॉस वाज देयर. एंड दिस वाज ऑल पॉसिबल बाय द digitalization system. So what he said, today digitization is the need of the day. If we don't digitize the things, initial expenditure is there, because as you digitize the things, manpower आपकी कम होगी, लोगों को job हो सकता है कम हो जाएगा, तो उस पे भी लोग चिल्लाएंगे. But initial investment, that is important. We all have to accept that investment initial in the beginning, and then return comes later on. Because as he said, utilization of time, time management, data keeping. If we have to have the cloud system, if we get involved in that, you have all the data system. Like he said, waiting time, because the doctor are the most costliest thing. So if we can utilize that appointment system, waiting time, history taking, their data retrieval, and even in research and all you talk about, like e-ICUs, which we are talking about. Even Medanta is going in a big way with e-ICUs. We have already started e-ICU at various centers. We try to manage 24/7 by our own place. We have a command center. And if the patient gets sick, he is shifted to our place. Maybe sometimes our ambulance goes and he picks up the patient. So the time digitization ka hai, we all have to accept, we cannot be mediocre. But initial investment, whether it is at government level, whether it is at corporate level, you have to spend, you have to get it in the mind of the people. If you don't go technical savvy, then you are gone.
So if I take a crux of what Dr. Rakesh has said, that it may be that invest for tomorrow. It can be initial investment, but that will be the game changer for future. I'll come to Dr. Raj Gopal. He's the CEO of Chandan Hospital. Because I'll ask a connected question, because what Dr. Rakesh has said, that invest in future or invest for future. I remember in one of our healthcare conferences, the Secretary of Maharashtra, Secretary Public Health Secretary 2, Mr. Naveen Sona came and he said, can we think of, he just give a suggestion, Ranjan sir, that in the hospitals, be it government hospital or private hospital, we see on the bedside nurses are there always noting down on paper. A simple thing, can we replace that with tab? That will, again, that way we can reap benefits of technology. Lot of wastage of paper will be saved. But as your CEO of a hospital, are you ready to invest that amount of money? Because that's a one-time cost. Because buying tab for at least 500 nurses in a hospital, it's a costly thing. But are we ready to invest that kind of money, as Sir has said, just to invest for future? Your thoughts on that?
Definitely, we've already done it in our hospital. The only thing is you don't need 500 because there are 500 nurses. You don't need 500 tabs. You can. The mobile application is also
Yes.
quite important. But just a little deviation from there. All of us, when we talk about technology and innovation, we go software side, and it's mostly how can we put in more software, put in more software. Like, but what I'm seeing here is everybody is talking also about the hardware side. Hardware is not only about tabs and computers. Hardware is also about the equipment that we use. So equipment that we use is also being upgraded and moving very, very fast. For example, if you look at ultrasounds initially was to see size, texture of different, parts of your abdomen. But now then they've developed into such high-end ultrasounds. You put it on an endoscope, you can go into the lung, you can go into the gut, you can see lesions through the ultrasound. You can go in, now you've got the IVUS, intravascular ultrasounds, where you go into the artery. Now people might say, why do you need it? And so I was asking our cardiologist, why would I need an intravascular ultrasound when you already have a catheter? So he said, okay, when you reach a block in your artery, you know that there is a block, but you don't know what's beyond the block. So if you want to know what's beyond that block, if there's 3 more blocks beyond it, you have an ultrasound and you know what's happening behind it. So you have to combine both. So coming back to your thing about investing, most hospitals now have a proper system in place where you're investing not only in the software side of things, you have to invest in the hardware side of things. And those are the kinds of investments that somebody else was saying that, I think you should start looking at ultrasounds also. But they're saying that no equipment stays beyond three years. So that is true. After 3 years, the maintenance of that equipment is much more than actually running it. So when you're talking about money, it's money not only in the innovation and in the technology that's software, because software generally is much less than in the hardware. Like everybody was also saying that, I think in Dr. Sanjeev was saying that they have a whole command center. Now you have to invest in that command center. It's not easy, but it's a one-time investment. So you need to have a proper plan in place about what you want and then invest, because money is not growing on trees.
Right, right. So time is running out, but I'll still ask one question to all of you. I'll start with you. Yeah, because that time I started with that side, let me start from this side. When we're talking about digitization and technology, one of the important part is that we're talking about data, huge amount of data being garnered and nurtured, right? But are we also focusing on another aspect of data management, that is cybersecurity? In today, uh, uh, we have the AIMS Delhi CIO was here. We know what happened in the AIMS Delhi. So are we as the hospital chain owners or the leaders from the hospital chain, are we also focusing on that? Because when you're talking about, because we have to focus on that. So how much importance you're giving to the cybersecurity aspect of the data, because every day we're dealing with data, especially for a sensitive data from hospital. Your thoughts on that?
So, after patient care, I think the second most important thing for us is data security. Not only patient data. For example, previously it used to be always electronic medical records. Only the medical records were online. Now, for our HIS, everything is online. Our inventory is online. Even our power grid is online. I can know which part of my power grid is taking more power than the other parts. So everything is online. Everything is moving mobile. So it's going into applications. Of course, data is important, and we know from the AIMS experience that we've been attacked. Every hospital has faced attacks, and it's not only for your because your financial information is also online. So of course, after patient security, patient safety, data security for us is the most important thing that we are.
Dr. Rakesh, your thoughts on that?
No, definitely, I agree with him that you have to have a robust system. And all the hospitals and others, we have an IT departments and all those which look after that. But cyber security, as we have seen in All India Institute happening, that's one of the most important thing. Because if your data is hacked, sometimes the patient privacy goes out and patient can sue you that how come you're, like now we are facing a problem, sometimes patient comes in the OPD or his discharge, as soon as his reports are written, he gets a phone call from outside. I don't know how the data leaks. We are making all efforts, but we are not able to control. He gets a call, you come outside, we will give you a discount of 30%. We are trying to find out the ways and means and all that. So digital system के फायदे भी हैं, नुकसान भी हैं, बहुत सी problems हैं. But ultimately we have to go with that. And security as such, it's very important.
Dr. Sanjeev, your thoughts on that?
I think it is extremely important to secure yourself, and there are, again, our command center manages all the phishing attack which is happening. So it's real-time captured. But then data security is critical, like all tumor boards happen online. So there's no physical meeting. So histopathology will share their image gets shared, nuclear medicine gets shared, and then the discussion happens. Similarly, institutional ethics committee is all online. So you don't have to look at the consent, back translation, Hindi consent, regional consent, patient information. So it's all there, and you can actually track who's going to make those changes. So that it's all ethical, documented, stored in cloud. So things have moved so fast that those digital security, de-identification, confidentiality is extremely critical, and we could also be, other than losing that, we could also be definitely sued, and it's our ethical principle and value that we should also protect it as much as possible. And there are ways and means to protect
Yes,
it.
because there are two challenges. One is obviously securing your data and also having a skilled manpower to do that kind of job. I'll come to Dr. Atul Kapoor. I'll end the discussion with perspective from Dr. Atul. Sir, your thoughts on that?
My thoughts are no different from all of us. We have to invest huge in data security, and basically, besides data security, we will have to have lots of applications and lots of security of patients' data. And again, what's happening now in this your Aishman AP PMJ. Everybody will now have a ID code. And every doctor will have an ID code, every nurse will have an ID code, and accordingly the patient will carry his data on a mobile. He'll share with you for 10 minutes, 5 minutes, or whatever it is. So anyway, the future is there that we all have to gear up and have our robust IT systems with cyber security, which is most important, especially say inventory management, as you said. You see, our entire inventory is on SAP. Now SAP, you can't tamper with, So then that way it's a security for me that whatever we decide on the rates, my people can't tamper with it. So a lot of things have come up and I think our thoughts are universal on this.
And thank you all of our esteemed panelists. A huge round of applause for all of them. To Dr. Atul Kapoor, Dr. Sanjeev Singh, Dr. Rakesh Kapoor, and Dr. Raj Gopal. I would like to invite Sri Ranjan Kumar sir to come on stage and kindly hand over the mementos to our speakers. We can start with Dr. Atul Kapoor, CMD, Regency Hospitals Limited. A huge round of applause for him, please. To Dr. Sanjeev Singh, Medical Director, Amrita Hospital. To Dr. Rakesh Kapoor, Medical Director, Medanta Hospital. And Dr. Raj Gopal, CEO, Chandan Hospital. And sir, can we have a group photo of all the speakers together, please? We can have a group photo together, sir. Thank you so much, sir. We'd like to thank Department of Medical Health and Family Welfare, Government of Uttar Pradesh for being the host partner, and also Ranjan Kumar, Secretary Medical Health and Family Welfare, Government of Uttar Pradesh for being the program chair and thanking us. And thank you, sir, for realizing the vision of this conference, sir. And I think I'll take a crux from what has been said in this panel that let's invest for tomorrow to make a better and healthier tomorrow. On this note, thank you so much for joining us. Do join us for lunch. Goodbye. Take care.